video on a respiratory assessment of a tracheostomy long-term ventilating patient when they come into a A&E or hospital setting. What we're going to do is we're going to give you a little bit of scenario of what our young man is going to present with a bit of a history, and then my colleague is going to go through an assessment that they would lead with that child, and I'm going to play the role of parent where I'm going to facilitate in that assessment of our little Henry here. So the presentation we've got here is little Henry. He's 3-year-old and he's come into A&E with his worried mum because he's become unwell over the last 3 days. This child is known to have tracheal malacia with a neuromuscular condition, so as a result has a size 4 P bivona flexed end uncuffed tube in place, and he is on his ventilation 24 hours a day. He recently was started on very small amounts of time off his ventilation onto his Swedish nose for 1 hour twice a day. But over the last 3 days, Mum has reported that she's noticed his secretions becoming a lot more thicker and a lot more of them. He started to get a bit of a cough and a bit of a high temperature. Henry's normally usually fed by his PEG tube, and Mum has again noticed that his abdomen seems to be slightly more distended than normal, but she has continued with his feeds as normal. She reports that he's been having wet pads as normal, but is generally just a bit concerned that he's not his sort of normal self. He seems to be quite disinterested in the environment that's around him. So I'm going to hand you over to my colleague that's going to do her respiratory assessment. Baseline obs that have been given to you are that his heart rate is 120, that his respiratory rate is sitting around 20 breaths per minute, and his oxygen saturations are 93% in room air.
Right. Morning, Mum. My name is Anthea, and your little boy is?
Henry.
And why have you come to A&E? Hi, Henry.
As I said to your colleague just before, a couple of days of where he's just not been himself, a bit of a temperature, his secretions are much thicker than normal, and his oxygen saturations are a little bit on the low side. But the biggest thing I'm sort of worried about is that he just doesn't seem himself. Normally, he's very interactive with his family and with his carers. He'll play on the iPad, we'll play games, we'll watch movies, but he's just, a bit like you see now, he's just sort of sat there, not really, it's almost like he's too tired to do anything, doesn't want to just do anything, just wants to sort of just sit here and not really respond to us. And this is not normal Henry. You'd normally have a smile from him.
Okay, so what we'll do is I will just ask you some questions just to find out kind of like what is actually going on with Henry, how his breathing's changed, and see if we can get him more comfortable. The first thing I'd like to ask is, I notice he has a tracheostomy.
Yeah.
What size is his tracheostomy?
So he has a size 4 P bivona flexed end.
Okay, and when did he have it put in?
So he's had this since he was a baby, so he's had it for years and years now.
Okay, and the reason he had it put in?
So when he was born, they realised very quickly that he didn't seem to breathe unaided. So he was diagnosed with a neuromuscular condition. So he then, we were then told that he would need the support of a breathing machine for life. So he had the tracheostomy put in as a way to provide that support.
Great. And what is his normal parameters? So with regards to what does his normal respiratory rate, how does he normally breathe?
Okay. So he's on his ventilator 24 hours a day. Although we have just started some time off the ventilators. He was having an hour twice a day on his Swedish nose, but since he became unwell, I wasn't really happy to do that, so I've just stopped that. He's normally on his wet circuit overnight and just on his dry circuit during the day. But again, where the secretions have been really thick, I've left him on his wet circuit for longer. But I've just obviously just put him on his dry circuit to come into A&E today. But he's been on his wet circuit sort of more than usual because I thought that would help with his secretions. Sort of respiratory rate rise, I don't really ever count it if I'm honest. I kind of just tend to look at him. Because of his condition, you'll often see that actually from a chest point of view, his chest doesn't move any quicker if he's unwell. It tends to stay the same, but he'll just give us signs that he's struggling a little bit more. So often he'll get quite sweaty and quite clammy because he's almost like he's telling us he's getting a bit panicky.
Sure.
His heart rate will go up, so that 120 for him is quite high, because when he's normally just sort of sat down and chilling out, it'd be much lower than that. So again, that was a sign that something wasn't quite right. And he just kind of gives you this look of just to sort of say, I'm not happy, I'm not comfortable. His oxygen saturations tend to be higher than that, so normally when he's well, when we have him on the monitor, which again during the day if he's well we don't tend to have him on one, but if we ever worry enough, say overnight his carers have him on a monitor, he's normally in the high 90s, so this is lower for him. But I have a plan I have from his tertiary centre that tells me what to do, and actually his saturations have to fall consistently below 92% before I need to sort of administer any oxygen or anything. And actually he hasn't had an oxygen since he was a baby, so the last time I spoke to his team they said if he became unwell and his oxygen levels were low, don't apply oxygen. Actually they would want someone to sort of see him.
Okay.
So as I said, he's kind of on that cusp of whether I need to do something about it or not.
So the rationale for asking Mum questions with regards to his history as to why he had the tracheostomy inserted and what type of tracheostomy is firstly to establish if he has any problems with his airway that we would need to know in advance with regards to if there's any abnormality in an upper airway or the lower airway. Also trying to find out what type of tube he has, whether it's a cuffed tube or a cuffless one. Again, it's always important to ask parents because they will be able to tell you why he has the cuffed tube or cuffless. I just need to ask you a few more questions with regards to Henry's tracheostomy.
Yeah.
So you mentioned that he's been having some secretions from his tracheostomy. Have they been more than normal?
Yeah, they have, and they've been quite thick. We've sort of tried to manage them with a couple more nebulizers just to see if that would help, but they are definitely thicker than normal. Normally he's quite loose and he sort of pours, like he pours out of his mouth, he normally pours out of his trachea, and we can suction it very easily. So this is quite a new thing from him, and my night carers have said even overnight when normally he'd be quite easy to sort of clear the secretions, they've struggled on a couple of times and had to give some extra nebulizers and things.
Okay, and what colour have the secretions been?
Anything from a bit sort of creamy white to a nice sort of tinge of sort of yellow, and it tends to be first thing in the morning they're really yellow and sort of thick, and it seems to get a little bit better over the day, and then by the evening they tend to get that really thick yellow. And they smell a bit unusual here, because normally his secretions don't smell, but they definitely have a bit of an unusual smell as well.
Okay. So the rationale for asking the types of secretions, the quantity of secretions, and the colour is just to establish if it's changed from the norm and it's an infection is brewing. The other question I wanted to ask you, if the secretions are becoming thicker, have you needed to do a tube change recently related to this?
No, we haven't. He had his tube change done about 3 or 4 days ago, and that was his normal one, so that was his monthly one. But no, we've managed, I think with the nebulizers and things, we have managed to sort of clear them so we haven't had to do like an emergency one or anything, no, not yet.
And have you noticed any additional secretions around his stoma site?
So normally it's quite wet, because normally they're quite loose. And again, I would say the secretions that are coming out of his tube are very similar to what's coming around here. They're quite thick, they're quite sticky. This dressing, like normally, can stay on for a day and look pretty good. We've noticed sometimes by the afternoon this is getting quite sort of gunky and not particularly pleasant. So we have been, if you allow us, we have been changing that a bit more frequently just because we don't want that sitting on his skin. Any
smell at all?
Smell, again, a bit like the smell of secretions. It's just a bit of an unusual smell here. Normally, as I said, his skin and his sort of stoma site and stuff we keep really well. His skin's quite fragile, so we're really kind of on it when we do his cares and things. And I do it every day with either Dad or one of his carers, so we monitor it really, really well. So yeah, again, it's unusual that there's a bit of a smell coming off, but we didn't know if that was just kind of a bit of part and parcel, that he just obviously just wasn't quite right.
Did you mention it to your community nurse for them to come and take any swabs?
I did. They said obviously just at the moment keep an eye on it, because by this point he hadn't had a temperature or anything, so they said just keep an eye on it. I'd already said that I was kind of like cleaning it more regularly and changing the dressings and stuff, so they said just keep an eye on it, because at the time he seemed okay, but they said obviously any changes to let them know. But I think with the temperature and his oxygen levels being lower and just the way he is, I just thought I'm going to bring him in. But normally at home, if it was sore or anything, my community are quite good. I can send them a swab, or something like that, and they'll just send it off to the GP for me and stuff.
I'm sorry, Mum, did you say the trachea site and his neck area is healthy?
Yeah, that looks all pretty good. I think now that we're changing this a bit more often, we've managed to keep it nice. As I said, we're probably a bit OCD, but I like to really keep an eye on this and make sure that it stays with, because he gets quite sweaty and clammy. I like to make sure that this is still looking nice. So yeah, at the moment that's still looking, I would say, normal for him.
So the whole time I've been speaking to Mum, I've been doing my own assessment of Henry. I've been looking at his chest movement to make sure it's both rising at the same time. I've been trying to see how his work of breathing is. Does he seem to be working a little bit harder? Does he have any nasal flaring? Is there any different signs around his mouth? And can I see any increased work of breathing on his abdomen? So I just had a thought. You mentioned he had a temperature.
Yeah.
Has he been coughing as well?
So he doesn't have a particularly great cough because of his condition. So we have a cough assist machine that we use to help clear his secretions. Because actually, even on a good day, he very rarely is able to cough and clear the secretions himself. So we've been doing that as per normal. So he has a cough assist session in the morning and in the evening, and he has nebulizers before that. And that's something that either me or Dad or the carers do. We've been trained to do all of that.
Sorry, Mum, your ventilator's alarming.
Okay.
So I just wanted to stop and check the vent.
Okay. That's because my oxygen sensor needs replacing. My ventilator's due a service. But actually the ventilator itself hasn't really been alarming any more than normal, because again that's one of the things we tend to look out for, is the ventilator alarming more than normal. And again, obviously overnight, my carers sort of report back to me in the morning and they've said that it hasn't particularly, during the day, or I wouldn't say that it has particularly alarmed more than normal.
So he hasn't generated any different alarms that they've been worried about?
No, not particularly. He has those odd alarms like when you turn him and things overnight, but nothing I would say that they've reported back to me, and I've not seen anything during the day. Obviously more alarms because we're disconnecting more to suction and things like that, but I would say like how it is now, where it's actually quite quiet, I would say that's probably fairly normal for his ventilator. We did go through a surgery, it was driving us mad, but the team changed the alarms for us, which was great.
While we're talking about his ventilation, does he have any additional settings on his ventilation?
So he has a well and an unwell, and then obviously he has a wet and a dry program as well. But we haven't had to use his unwell program for a long time, because actually he's been reasonably well since we got home. We tend to just manage the little coughs and colds quite well, but yes, we do have an unwell program, which is ever so slightly higher, like numbers, pressure support, whatever you call it, that we're able to do. But as I said, I've got this sort of plan from our tertiary centre, and it sort of tells me a flow chart what I'm supposed to do. And again, at that point, I'm sort of happy that he's looking okay, and I don't need to quite go down on that. But I think I have got to that point where I feel like I need to be reassured that I am doing the right sort of things. That's why I'm going to come in to see you guys and get your sort of thoughts.
Okay. So before I go any further, Mum's mentioned some key pieces of information that we need to have. We need to have the escalation plan, so we can see where Mum is with regards to the escalation plan, and also what has been planned for Henry. I would also ask Mum for her grab sheet, which may have her prescription settings, which would actually, I'd be able to check against the ventilator what the settings are, just to make sure that they are correct. The whole time I have been assessing Henry, he seems comfortable. I would double check just by asking the doctor to come in and assess him, but additionally, from a nursing point of view, I would also make sure that the oxygen is connected, and also if his blue emergency box is nearby. Okay, Mum's gone to go and get his wet circuit and any additional equipment he needs. While she's gone, I will just do a quick recap of my assessment. I'm hoping it'll jog any additional questions I can ask Mum when she comes back. So from an ABC point of view, looking at his airway, we found out from Mum that he has a tracheostomy by Bona 4, uncuffed, and that it was patent. Purely patent because Mum was able to suction down without any problems. She'd recently done a tube change a couple of days ago, which also was good in confirming to us that nothing emergency had happened. His secretions that Mum was actually suctioning up were thick to creamy and yellow. Mum reported that around his tracheostomy site in his neck was healthy, but that they needed to change the dressing more frequently due to the secretions. The smell that came from the site was only secretion related. Moving on to his breathing, Henry continues to be on his normal ventilation settings. On his dry circuit, as you can see, he's come in. Mum normally keeps him on his dry circuit, but she's had to swap him to his wet circuit as he's become more unwell. She has stopped also putting him onto his Swedish nose. To help with the secretion management, Mum increased his nebulizer regime, so she used it more frequently. Henry actually has a cough assist machine due to his cough being quite ineffective. And one of the questions we asked Mum was, did she need to use the machine more so than usual, just to help clear the secretions. Mum also stopped the time off the dry circuit, so she kept him on his wet circuit more. And this was part of the escalation plan that Mum received from the tertiary centre. She hasn't needed to put him into any oxygen or increase his vent settings from his well settings to his unwell settings, as on the escalation plan, Henry still falls into the sector where he can remain on his normal settings. When we felt Henry's hand, Henry was warm and well perfused. His heart rate was slightly increased, and Mum was worried about this as it was slightly normal, above normal than what Henry is normally at. His temperature was increased as well, but it was a red flag that Mum raised the point about his heart rate. He was more sweatier than usual, and Mum states that Henry does become more sweatier if he's unhappy or uncomfortable. However, his nappies were wet and the stool consistency was the same. We noticed from our assessment that Henry looked well hydrated, as his lips were nice and pink and moist. Moving on to his feed, Mum had continued feeding him via his peg, but his abdomen did look distended, and we'd asked Mum to discontinue the feed while we continued to do so. She did mention Henry would become unhappy if his feed was discontinued, so we will keep an eye out for that. Mum repeated that Henry was not himself, and this is a red flag for us. Whilst Mum's been away, he has not engaged with me and has been disinterested. He's also not vocalising, and Mum said that he's actually made noises around his tube. When Mum comes back, I will ask her to connect the wet circuit, as I'm not familiar with that. I will also ask Mum for the escalation plan so that I can obtain some more information with regards to contacting the tertiary centre to let them know that Henry's here. And the last question I will ask Mum is to double check that he doesn't have any rashes on his body.